Welcome to the St. Francis CME podcast. I am Brandon Kitchens, podiatrist at Tulsa Bone and Joint. I have no disclosures. This episode has been approved by the St. Francis Hospital System CME program for AMA PRA Category 1 credits. See description for details. Today's topic is custom orthotics versus over-the-counter orthotics, or known as OTC. Let's get started. Based off of the podcast today, I'd really like us to kind of be able to tackle a topic that generates strong opinions, not only in my profession, podiatry, but also orthopedics, sports medicine, physical therapy, and some other types of professions as well in healthcare, all going around orthotics. So the question always comes up, are customs truly superior? Well, let's kind of tackle what the evidence out there actually supports, okay? Are the over-the-counter devices enough for most patients? And when does cost justify the benefit? So we're going to talk about the biomechanics, which I'm super passionate about. It's super important to understand the clinical indications, cost effectiveness for our patients, and the best available evidence to guide real-world decision-making. Okay? So before we really dive into that question, we need to understand, what are we really comparing, right? Over-the-counter are often prefabricated, mass-produced, so it's kind of one size fits most. They're limited in the customization, but the cost is usually pretty inexpensive, $20 to $80. Custom, on the other hand, they can be very expensive, sometimes thousands of dollars. They're modifiable, so we can put posting, cutouts, top covers. Oftentimes, they're casted or scanned to the patient's specific foot type. So once again, the question becomes, do custom devices improve pain and function better than the over-the-counter devices? You're going to really dislike my answer. It depends, okay? Let's start with a scenario, right? Plantar fasciitis. I see a lot of this in my clinic on a daily routine. The Journal of American Podiatry Medical Association found that both prefabricated, right, over-the-counters, and custom orthosis improved pain, and that there was no statistically significant superiority of custom devices at 3 months. That's plenty of time to figure out if the orthotic's helping, along with other modalities, maybe an anti-inflammatory, physical therapy, stretching, you name it. There was also a study that was a systematic review out of the British Journal of Sports Medicine that concluded similar results. Strong evidence that foot orthosis reduced short-term pain, but there was no significant statistics on whether custom or prefabricated actually had a play within plantar fasciitis. So for straightforward plantar fasciitis, over-the-counter is often appropriate first line. Now let's talk about patellofemoral pain, right? So we're kind of getting up into the knee. There was a study out of 2008 by Collins and BMJ that showed that prefabricated orthosis improved short-term knee pain, and it was comparable to just physical therapy outcomes early on. There was no clear long-term superiority of custom devices, though. So once again, prefabs are effective. Let's talk about pediatric flexible flat foot. I see a lot of kiddos in my office, and that is often a question. Should my child have custom orthotics, or can I get them over the counter? Well, let's just state the obvious, right? Orthotics can reduce the symptoms, right? There are studies that suggest that, but they do not structurally correct the arch height long term. There's no strong evidence that custom devices alter the natural arch development. That being said, we're really kind of helping with the symptoms, right? We're trying to get them to play more, to run around more, to be more active. It's not going to correct anything radiographically within an x-ray. Oftentimes, if custom orthotics are needed, they're in the form of like a brace of some type. So that's where it really depends. Let's get into something a little bit more black and white. Diabetic foot ulcer prevention. Diabetics is an epidemic within this country, there's no doubt. So this is really where things are going to change from the over-the-counter standpoint to the custom standpoint. There was a randomized controlled trial published in Diabetes Care demonstrating that custom pressure-relieving orthosis reduce ulcer recurrence. This is where offloading matters, right? This is where we can really dial in the insert. In high-risk neuropathic patients, customization improves pressure redistribution. Super important. There's a stronger indication for custom devices in high-risk feet. On that same note, let's talk about rheumatoid arthritis and severe deformity patients. There are studies that show that custom orthosis improve pain and function in RA. Deformity-specific contouring improves the pressure distribution. So these patients are actually going to get a lot better with custom orthotics versus over-the-counter. These are patients that may have a Charcot disease. If you don't know what that is, highly recommended to go to Dr. Google, check it out, see some pictures. You're going to look at an x-ray in a foot and you're going to say, what is that? Let me send it to my buddy Dr. Kitchens. He'll know what to do. Post-surgical biomechanics, right? Unfortunately, after a traumatic event, we try to fix the foot. Sometimes there may be post-traumatic arthritis, limb length discrepancies. Maybe they have a really high arch or a really flat foot to where we have to accommodate for. Often, these will benefit from a custom device. Now, that all being said, we're treating real-world people here. Sometimes the over-the-counter is 5 to 10 times less than what a custom costs. And sometimes you can get similar outcomes. So it really just goes to know what the patient's dealing with, understanding the patient, knowing the patient, because custom devices may not be cost-effective as the first-line therapy moving forward. However, in more simple, mundane things, it may. So, in complex pathology, revision surgery avoidance or ulcer prevention may just justify higher cost. So the economic question is not are customs better, it's are customs better for this patient? Huge point. So kind of just to land the plane here, clear indications for custom orthotics are diabetics, severe deformity, that could be Charcot, PTTD stage 2 plus, limb length discrepancy, post-traumatic deformity, those types of things. When over the counter is reasonable, plantar fasciitis, mild flat foot, patellofemoral pain, recreational runners, and individuals that can be a little bit more active. Biomechanics, though, is really where the rubber meets the road here. I cannot emphasize this enough. Modern research shows that orthotics do not realign the bones, that's where surgery is involved, works primarily via load redistribution and reduces the tissue strain, right? That's why they are symptom modulators. They're not structural cures, okay? Final take-home points here as we round this out. Orthotics work, right? Give them a shot, right? If you're not sure, over-the-counters is always a good option. Custom is not universally superior. Prefabricated devices are often sufficient for common overuse conditions, and the evidence supports symptom-driven prescribing, not blanket customization. The smartest prescription isn't the most expensive device. It's the right device for the right pathology. That completes today's episode. Please follow the link in the description to complete the evaluation that's required to claim your AMA PRA Category 1 credits. Thank you for listening to the St. Francis CME podcast.